Hi, my name is Monte Hueftle. I'm a mind-body coach helping people heal from chronic pain. And I'm going to make a very dramatic statement to you. If you follow this information today in this video session, I'm going to dramatically change your running life. I've titled this session, What Every Runner Should Know About Piriformis, Sciatica, ITBS, Plantar Fasciitis, and back pain. I've put together this brief educational video session just for runners to give you an alternative treatment for your running injuries. And even though you do not realize it right now, this information applies to the majority of you and to the majority of your running injuries. If you can accept and apply the information that I'm going to give you today, you will end over 90% of your pain symptoms that have been diagnosed and treated as a running injury. So here's my background. I want you to know where I'm coming from. Most of you have read my post on letsrun.com or runnersworld.com over the past 7 years. I'm a mind-body coach who helps people heal from chronic pain. Many times these have been diagnosed as a running injury. I've written 3 educational books and I've produced 4 audio programs on these physical pain disorders. I've been running competitively for the past 35 years since cross-country in high school. Today, at the age of 48, I average about 70 miles per week. I've run a 2:43 marathon, a 1:16 half, and a 33 10K. For 20 years of my running life, I suffered with back pain, itialioband syndrome, sciatica, piriformis, spasms, and just overall chronic soreness. I also had bouts of plantar fasciitis and runner's knee. The symptoms could be burning or shooting pain, they could be dull aches, it could be constant, or it could be moving around. I didn't know it at the time, but none of these were running injuries or caused by a dysfunctional body structure. I had all the typical diagnosis: curvature of the spine, leg length discrepancy, pinched nerve, slipped disc, inflamed muscles and tendons, and of course just too much running. And I did all of the physical treatments to correct my body. I had chiropractic, massage, physical therapy, special exercises and stretches, iced, rest, anti-inflammatories, and special shoe inserts, changing of shoes, knee braces, etc., etc. None of these ended my pain or my injuries. So here's what I want you to know. I eliminated all of these pain symptoms, all of these running injuries that I had been experiencing for 20 years when I learned that there's a chronic physical pain disorder that is caused by inner tension or inner stress. It is called tension myositis syndrome, or TMS, and it was introduced back in the early 1980s by Dr. John Sarno. So in this disorder, I was instructed to stop my physical treatments and instead focus on how I was generating inner tension in my body, in my life. So this is a tough diagnosis for runners or any active person to accept. We are so tuned into our body and conditioned to accept that pain means injury, which means a physical problem that needs to be addressed by physical means. I get that. I know that is where 90% of you are right now. And I also know that you need to run tomorrow. You must keep training and you have goals to reach. But let me ask you a question. Are your physical treatments working? Are you in a pain cycle, eliminating one symptom and then experiencing a new one? Are your injuries chronic? Are they taking longer than a month to heal? Have you accepted in your life that you are just going to feel chronically sore, chronically stiff? I hope that you can stay with me just for another minute or so. In these pain disorders, the cause is inner stress or tension. The pain that you are experiencing is very real, and there's a biochemical event in our body, a process called oxygen deprivation. Your nervous system gets overloaded with inner stress. Automatically, it restricts blood vessels, which then sends a deficient amount of blood and oxygen to muscle and nerve tissue. And so this is the variety of symptoms and locations that you experience your pain throughout your body. So I've been pain-free since I started treating my running injuries as tension-induced pain over 9 years ago. I encourage you to learn more about this disorder. I've created an educational video session that you can view, and there is an abundant amount of free information on my website. So I encourage you, go to www.runningpain.com. Fill out the Think Psychological survey. I'll provide you a personal response and next action steps for you. Read and learn about TMS, how to heal from it, and watch the video sessions. If this information resonates with you, it can dramatically change your running life. If this information doesn't resonate with you, if you're just not ready for it, then don't worry about it. Let it go. It will always be here if you have the need for it. So thank you for watching this session today, and I hope that you learned something and it can be helpful for you.